Hello and welcome to today's videocast on managed care and national health insurance. I'm Dr. Cornejo, and over the next few minutes, we'll explore how managed care has transformed the healthcare landscape, the fundamentals of utilization review, and the key elements of the Patient Protection and Affordable Care Act, ACA. Let's dive in. By the end of this videocast, you should be able to describe the common models of managed care organizations, understand the purpose and process of utilization review, outline the purpose and various titles of the Patient Protection and Affordable Care Act, ACA, of 2010, discuss the various court rulings involving the ACA. Managed care is a system designed to structure and coordinate how healthcare services are financed, purchased, delivered, measured, and documented. With managed care, consumers may face certain constraints, such as limited provider choices and the need for prior authorization for some services. Limitations on provider choice. Patients may need to select from a specific network or approved list. Prior authorization. Some treatments or procedures require approval before they can be carried out. There are several models within managed care. Let's review them briefly. Health, maintenance organizations, HMOs, preferred provider organizations, PPOs, exclusive provider organizations, APOs, point of service, POS plans, experience-rated HMOs, especially HMOs, independent practice associations, IPAs, group practice without walls, physician hospital organizations, PHOs, medical foundations, management services organizations, MSOs, vertically integrated delivery systems, horizontal consolidations. Federally qualified HMOs meet federal standards to receive grants or loans. State HMO laws vary, but they oversee consumer protections and managed care regulation. Case management firms and third-party administrators can coordinate care, manage claims, and negotiate with providers. Utilization review is critical to managed care. It focuses on ensuring that services provided to patients are medically necessary and cost-effective. Prospective review, assessing the appropriateness of services before they are delivered. Concurrent review, evaluating patient care during the course of a treatment. Retrospective review, looking at the care after it has been delivered. Utilization management firms specialize in these reviews and can be held responsible if their decisions lead to harm. This is known as negligent utilization review. Utilization review is critical to managed care. It focuses on ensuring that services provided to patients are medically necessary and cost-effective. Prospective review, assessing the appropriateness of services before they are delivered. Concurrent review, evaluating patient care during the course of a treatment. Retrospective review, looking at the care after it has been delivered. Utilization management firms specialize in these reviews and can be held responsible if their decisions lead to harm. This is known as negligent utilization review. Managed care organizations must navigate various legal pitfalls, financial incentives, disclosure. Plans must often disclose how physicians are paid, especially if incentives might influence care decisions. False and misleading statements. Ensuring all communications and marketing are accurate is essential. Price fixing. When competitors collaborate to set prices, it is considered a per se violation of antitrust laws. Market power. Healthcare entities must be cautious about dominating a geographical or product market, which can raise antitrust concerns. Now let's talk about the National Health Insurance, the Affordable Care Act, ACA. In 2010, the Patient Protection and Affordable Care Act, ACA, was enacted with two primary goals: increase the number of Americans covered by health insurance, decrease insurance costs while eliminating discriminatory practices. Upon its passage, several reforms took effect right away: elimination of lifetime and unreasonable annual limits, prohibition of policy rescissions, ensuring insurers don't drop people unfairly, coverage for pre-existing conditions, free preventive services and immunizations, extended dependent coverage up to age 26, uniform coverage documents, simplifying comparisons, caps on non-medical administrative expenditures, improved appeals process, reinsurance programs for early retirees, internet portals for coverage options, administrative simplification to lower costs. Here are the most important ACA Act titles. Title 1, Quality Affordable Health Care for All Americans. Title 2, The Role of Public Programs. Title 3, Improving the Quality and Efficiency of Healthcare. Title 4, Prevention of Chronic Disease and Improving Public Health. Title 5, Healthcare Workforce. Title 6, Transparency and Program Integrity. Title 7, Improving Access to Innovative Medical Therapies. Title 8, Class Act. Title 9, Revenue Provisions. Title 9, Strengthening Quality, Affordable Health Care for All Americans. The Supreme Court ruled that the individual mandate requiring most Americans to buy insurance was constitutional on the Congress's taxing authority. However, it limited the federal government's power to require states to expand Medicaid eligibility to families earning up to 133% of the federal poverty level. Continuing ACA controversy. Politicians, insurers, and consumers have engaged in ongoing debates. Many insurance companies have withdrawn from high-risk markets due to financial losses. As a result, insurance premiums have risen in some areas, while some individuals with serious medical conditions rely more heavily on ACA coverage. So, managed care and national health insurance continue to evolve, impacting how healthcare is delivered and financed in the United States. From HMOs and PPOs to utilization reviews and the ACA, there's a complex array of regulations, models, and legal considerations shaping our healthcare system. Thank you for joining me for this videocast on managed care and national health insurance. I hope this overview clarified the key aspects of this chapter, including the many models of managed care, how utilization review works, and the fundamental changes brought by the Affordable Care Act. If you have any questions, please leave them in the comments or reach out to our team. I'll see you next time for another deep dive into healthcare law and policy.